Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Saba University Hospital, professor of medicine, University of Khartoum. This is a basic emergency care course. In this session, we are going to discuss altered mental status. Objective of this session about altered mental status: to perform secondary survey by sample history and secondary examination to recognize key history findings suggestive of different causes of altered mental status. List high-risk causes of altered mental status. Describe critical action to manage patient with altered mental status. Consider disposition and transfer of patient with altered mental status when you are not capable to manage in your facility. Altered mental status is a term used for a range of presentations. It ranges from sudden or gradual change in behavior, disorientation, irritability, confusion, or even coma. It may be due to primary brain condition like bleeding or tumor. It could be related to chronic psychiatric problem or dementia. Definitely we have to rule out other life-threatening causes first. Delirium, which is an acute change in mental status, always require full assessment. It is very important and key point to ask family member or friend about the baseline mental status when it is possible. The goal of initial assessment of altered mental status is to identify rapidly reversible causes and to recognize dangerous conditions requiring immediate intervention or transfer. The goal of acute management is to ensure that blood oxygen and glucose reach the brain and protect the brain from secondary and additional injuries. Always look at altered mental status as problem with oxygenation, so you have to assess and manage airway and breathing. Problem with hypoperfusion, so you need to assess and manage circulation. Perform ABCDE whenever there is problem. Fix it before you move on. After that, you do sample history and detailed examination. After we stabilize the patient, then we go to sample history. The most important thing, if we can ask a friend or a family member about the baseline mental status so we can compare the current changes to the baseline. Ask if there is any difficulty in breathing. Altered mental status could be related to hypoxia. That could be related to airway or breathing problems. Ask about vomiting, diarrhea, and headache. Vomiting and diarrhea can lead to hypoperfusion, and this can lead to altered mental status, plus severe vomiting and diarrhea can lead to hypoglycemia, and this also can affect the mental status. Vomiting and diarrhea could be related to increased intracranial pressure. Presence of headache can indicate intracranial process like infection, tumor, or bleeding. Dehydration and hypoperfusion can lead to dizziness and fainting. To know onset and progression of the symptom is very important. Rapid onset, think about infection, bleeding, or toxins and drugs. Gradual onset could be related to tumor or slow bleeding, while intermittent condition can be related to seizure or psychiatric illness. Ask about any recent fever. Fever can indicate intracranial infection like meningitis, encephalitis, or brain abscess. Serious infection in children and elderly can lead to altered mental status. Fever could be due to prolonged outdoor heat exposure. Some poisoning and some medication can lead to elevated body temperature. Ask about any weakness, clumsiness, or difficulty to walk, and this can indicate stroke or brain tumor. Presence of neck stiffness could be related to infection and inflammation, as in meningitis, meningoencephalitis, or subarachnoid hemorrhage, and even severe malaria. Ask about recent history of trauma or falls. Bleeding in or around the brain can cause altered mental status even days after the injury. Alcoholic patient, chronic drinker, can be subjected to minor or trivial trauma. Sometimes they don't remember these trauma and they can have bleeding inside the brain. Always consider unwitnessed trauma in patient found with altered mental status and no obvious cause. Ask about any recent depression or changes in behavior. Drug and alcohol use or psychiatric problem could be a cause. Consider possibility of suicide attempt by poisoning. Does anyone else from the same family or location have these symptoms? It could be related to similar exposure like carbon monoxide used in cold climate for indoor heating, or due to exposure on like pesticide among the farmers. In sample history, then after symptom and sign, we go to allergies. Allergy to medication or other substance, recent exposure to known allergens, change in mental status due to exposure to allergens could be related to hypoxia or hypoperfusion. Ask about medication history. Currently taking any medication, you have to get the medication list, any new medication or change in doses. Some medication can interact with each other. Some of them can lead to hypotension and hypoperfusion. Some of them, like pain medication, like opioid, morphine, and ampicillin, can affect the mental status in case of overdose. Sleeping medication also can affect that, plus seizure medication. So detailed medication history is important. In sample history, after we take symptom and sign, allergies, medication, then we go to past medical history, ask about different illnesses. Diabetes, for example, it can lead to hypoglycemia that can manifest as altered mental status. Also, patients with diabetic ketoacidosis or hyperosmolar state, they can have hypoperfusion, they can have high blood sugar, increased thirst and urine output, and hypoperfusion can lead to altered mental status. In addition, acidosis itself can lead to altered mental status. Ask about presence of heart disease, history of stroke, history of hypertension. Heart attack can lead to altered mental status because of pulmonary edema and hypoxia, and when there is cardiogenic shock due to hypoperfusion, it can also lead to altered mental status. Those with heart disease are at increased risk of having stroke. Altered mental status with stroke history may indicate new stroke or brain bleeding. Those with old stroke can have recurrence of symptoms with any severe illness, like presence of fever or dehydration. High blood pressure increases the risk of brain bleeding. History of seizure. Does the patient have a history of convulsion? Is he on medication? Does he take them regularly? Is there any change in the dose? And also, you need to see if there is any witness convulsion and history of fall or trauma. Patient can present actively convulsing, or they can present in post-ictal period. Usually, those in post-ictal period, they recover in half an hour to few hours. But if recovery is taking too long, consider other causes. In the past medical history, ask about HIV, tuberculosis, liver disease, or kidney disease. Those with HIV and tuberculosis, both conditions can affect the brain. In addition, HIV can increase the risk of other opportunistic infection. Those with liver disease and kidney disease can present with metabolic encephalopathy. Ask about history of long-standing alcohol use or history of drug abuse. Alcoholic intoxication or withdrawal can lead to altered mental status. Alcoholics have high risk of head injury and hypoglycemia. Sedative and opiate can lead to altered mental status, and both of them can increase the risk of fall and head injury. Pregnant lady with high blood pressure could be related to eclampsia, and they can have seizure and convulsions. Ask when did the patient has the last oral intake. Prolonged fasting can predispose the patient to hypoglycemia and dehydration, and both of them they can lead to altered mental status. Events surrounding the current illness, any recent trauma, any recent travel. Trauma can cause poor perfusion and altered mental status. Travel could be associated with risk of certain infection like malaria and other tropical illnesses. Events surrounding current illness. Sick contact may suggest infection. Exposure to chemical like in pesticide, it can suggest poisoning. Snake bite can lead to snake poisoning and envenomation. Exposure to extreme heat lead to heat stroke, and also very cold weather can lead to hypothermia. Drug ingestion can cause agitation, lethargy. Alcohol intoxication or withdrawal can lead to altered mental status. Take home, altered mental status cover a wide spectrum of symptom and sign ranging from changes, acute or gradual changes in behavior, disorientation, irritability, confusion, and coma. It could be related to primary brain condition or systemic illness. Always try to find the baseline mental status from a family member or a friend. In any patient with altered mental status, start with A, B, C, D, E. Then you go through sample history and secondary exam to identify any serious causes.